Hi everyone, I'm Darwin Natividad and I am here at CSA Medical Aesthetics. So I visited today for Dr. Contessa because of my concern about my face, especially with my double chin here. So I want to improve more jawline definition and to have my chin volumization and to have it masculinized. So for today, I will consult to Doctora what she will recommend for my today's consultation. So don't forget to like, share, and hit the subscribe button.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we'll have a topic, the so-called jawline definition for men. But before doing any treatment, let's welcome for the first time, Sir Darwin.
Hi! Hello everyone! So...
Yes, Darwin.
Doc,
May we ask how young are you, Darwin?
I'm 30 years old, Doc.
30 years old. So, very young. And for men, actually, what they want really is the lower part of the face to be well defined. Because to look masculine, you should have this like very good or sharper jawline, right?
Yes.
And even like a squarish chin, right? A pronounced, prominent chin. And looking at Darwin, you're good looking already, Darwin.
Thank you, Doc. Actually, my concern, Doc, is my double chin.
There
and I
you
want
go.
it to become more masculine look. Kasi I have a small face kasi, Doc.
Right.
So,
yeah. So there's the concern of Darwin. Because if you do an assessment, so right now we're focusing on the lower third of the face. So if you look at the chin region, as if like when you do a measurement, dun sa rule of thirds, it's like the chin is still like inadequate in terms of the length or the vertical dimension, right? Although it seems it has a good projection, but in terms of the length, it's still inadequate, right?
yes, Doc.
That's why with that inadequate length, it kind of created this prominence of the under the chin.
Yes,
okay,
this one, Doc.
You call it double chin. Okay, so the submental bulge there. And looking at the lateral aspect, so if you turn your face towards the opposite side, it kind of like lack that definition when you move your face to the side. So the angle of the mandible, okay, and then when you go to the pre-jowl sulcus, there's still that deficiency, right? So making now this upper neck region kind of like more prominent or more dominant, right? So this is something like, would you say it's already aging?
Actually, yes. It's one, Doc.
Yeah, that's one.
But,
and also,
I do gym kasi, Doc. So
Okay.
workout so every day. So I think it's one of the reasons that's why nagsag din yung ganito.
right.
And
So
I have the small face din.
when you're doing those physical workout, you're losing also fat,
Yes,
tissues, volume there, and then leading to the sagginess of some of our tissues. And also probably genetics also play a role. Probably if your parents may have like the lower third, shorter as compared to the upper and middle third. So a combination, genetics, lifestyle, the working out, okay?
Yes, no.
And you mentioned aging. Because they say aging starts at 25.
Yes,
You're 30. But
30.
still, you're young. You're still
Yes,
young
no.
looking, okay? So we want a treatment that will be, of course, non-surgical and as much as possible, minimal to no downtime at all. Because Darwin is also busy. He works a lot. But he still wants to achieve a natural and, of course, just a harmonious, well-balanced result.
Yes.
So what kind of treatment, what procedure will show you when CSA Medical Aesthetics return. And we're back. So we're doing a treatment for Darwin, focusing on the lower third of the face. So let's do an assessment. Now, the chin part of Darwin, as we can see on the side view, we've noticed that there's already a good anterior projection. So we checked on the Ricketts E line, it's fine. So what we noticed, so let's move to the center, Darwin. What we noticed was the deep sulcus here, okay? This part, the so-called labiomentalis fold, okay? So this one is kind of like so much of depth, or it's really that deep, right, Darwin? And because it's so deep, we notice that the apex of the chin is really projected anteriorly. So for Darwin, to elongate the chin, okay, to correct that vertical dimension, we want to improve this sulcus here, the deep sulcus or the labiomentalis fold here. So we'll make like a long rectangle here to be able to correct that. So Sir Darwin has a single pimple on the center of the chin. Now, we also want to improve the so-called labiomandibular fold. If you want to have like a masculine chin or square chin, we can also improve this so-called labiomandibular fold here. So these are the areas that we will do a so-called refinement, because you already have that good anterior chin projection. Now, to further lengthen and make the chin wider, squarish, we will also work on this prejowl sulcus here, and we'll make like another rectangular drawing here, and same thing on the opposite side. So we want to also improve the so-called, okay, the length, the width, and we want to make a squarish chin, okay? Because as I can see right now, it's kind of like a rounded chin for Darwin. So what we want is to masculinize your chin part and somehow hide this under chin region, okay?
Yes.
So this is the assessment for the chin region. Now let's go to the jawline area. So turn to the side, Darwin, okay? So first locate for the angle of the mandible. So the angle is here, and the ramus is here, and in the mandibular line. So we want to also improve that angle of the mandible. So we'll be injecting a product here. And to have that letter L of the mandibular line, the mandible angle, we'll also be injecting a product here on the ramus of your mandible. And to further make your bigonial width wider, so we'll be also adding a so-called product on top of the one that we will place on the supraperiosteal layer. Okay, so this is our markings. And before any procedure with injectables, we also have to identify where are your blood vessels, especially when you're doing injections using dermal filler. So for the jawline, we have to locate for the antigonial notch. So the notch is here. That is where you have your facial artery coming out. Okay, so we have to avoid the notch. Same thing on the other side. You have to palpate for that notch here. Okay, so it's in here, so avoid that. So again, your angle of the mandible is here, and then your ramus of your mandible, and then also for the body part of our mandible. Okay, so we have now our drawings, and we will avoid the facial artery. And for the mentalis foramen, palpate supraorbital notch here, and then make a straight line. And we also want to avoid the mentalis foramen there. Same thing on the other side, supraorbital notch, and then locate, and then avoid the mentalis foramen. So those are vital structures that you have to be cautious when you're doing your injections. So we did the markings. We also identified where will be our location of our product material. So next, so what will be the line that we're going to use? What treatment material are we going to use? To give that very good jawline definition, chin elongation, we'll be using our hyaluronic dermal filler. Okay, Darwin?
Yes.
So we have hyaluronic in our tissues. It's natural, it's safe, it's water polysaccharide, it's hydrophilic, attracts water, gives volume, definition, and contours the face, gives depth, everything. Okay, we need it also in our system. Okay, so we'll be starting with the injection of our filler. So cleanse the area again, disinfect the area. So before any injections, you can also numb the skin by applying your topical lidocaine cream. Apply it on the skin surface, leave on for like, depends on how many percent is your lidocaine. So it can be like 10 to 15 minutes, for others 30 minutes to 45 minutes. Okay, I'll be starting with the chin region. Okay, so we'll start with the center, Darwin. So we'll be improving again the length, the vertical dimension, and also improving the labiomandibular fold, as well as the so-called pre-jowl sulcus. The jawline area will be improving that angle of the mandible, and to give you that more masculine look, Darwin, or a chiseled jaw, square chin, well-defined, more pronounced, and contoured jawline area. Okay, so I'll start working on the so-called sulcus here, the deep sulcus or labiomentalis fold. So my entry point is here, disinfect again. I'll be using the cannula as our tool for delivery. I'll pinch the skin and then make an opening there, okay, and then rotate. And I have a cannula gauge 23 here. You can use also cannula gauge 25. And then vertically or perpendicularly glide towards that deep sulcus. And you can do a movement already, like gradually pushing your product into the area. So it's like a fanning movement also. So I just want to finish up to the 0.5 here so I can move to the opposite side for the other half syringe. Okay, so finishing that off and improving this side here. As you can notice, it's like already correcting upper part of your labiomandibular fold here. So further movement here, and there you go. So after that, I want to improve the so-called kind of like marionette line here. I'll use the same. So later on, I'll be using the half mil on the opposite side. I'll just finish with the right side here. Now for the labiomandibular fold, okay, entry point will be inferior. So disinfect again, please. Thank you. So I'll use another entry point for that, and then pinch the skin. So it helps in kind of like preventing any sensation of discomfort there. And I'll use the half mil remaining here. So perpendicularly direct your cannula and then glide towards the corner of the mouth. Some males, we can notice that they have narrow lips, and the way to improve or widen their lips is also via these methods that we are using, like injecting that deep sulcus there and also improving your labiomandibular fold. Okay, so gliding your cannula towards, it's like a fanning method again. You can fill in this section here. So we are again in a subcutaneous layer, and then you're using a cannula and you are giving about 0.5 mil. and you can do a delivery of so-called fanning method, and it can be like a retrograde or antegrade technique. So for those who have concerns of marionette line, so you can also make use of this kind of technique to be able to widen your chin, for men of course, because it's different when it's for women. For women, we want rounded chin, pointed chin, projected chin for women. So kind of like some resistance there. Okay, just pushing on that area there. So this is to improve the so-called marionette line and also the labiomandibular fold there. So some work here. It's not an easy technique. It's only for those injectors who've been doing it for a very long time. And again, only go to your qualified, authorized, licensed aesthetic physicians, dermatologists, and cosmetic or plastic surgeons, okay? Or those injectors for these kinds of filler material. So I have a substance that's really robust and very high G primer and very viscous. So when you push it through that cannula, there's really an effort to push the product. So cannula method is a safe technique, and sometimes I use needle depending on the anatomical area that I'm working on. So almost done here, because I wanted to make the chin look more masculine. Okay. So I'll also do the pre-jowl sulcus. I'll need another syringe of my filler. You're still okay, Darwin?
Okay lang.
So I already used one syringe on just on this side. So I want to improve the length, the chin length. So I'll use the same entry point, disinfect these. So this is improving your jawline, and we are in the pre-jowl sulcus. So we want to lengthen, widen the chin region of Darwin, more masculine look. So it's like several techniques just to work on the lower third of the face. So take note, avoid also the submental artery, which is a branch of your external carotid artery via the facial artery. Also avoid the marginal mandibular branch of your facial nerve. Okay, so I just want to improve this part here, lengthen this part here. So we're working on going towards that inferior level of the mandibular bone here. So we wanted to get rid of the double chin. Darwin was calling it that double chin, or I say submental bulge, something that is, Darwin said, probably the aging factor, and also nag-work out, si Darwin. So I wanted to finish it off with this 1 mil here. So I'll be working entirely on this right side first, and really be careful in placing my product. And I still wanted to improve that lower apex part, just to lengthen the chin region. So as to the number of the syringes, it will really depend on your assessment of your patient. So some will need less, some will need more. So it's a case-to-case basis. That's why the younger you are, the earlier you treat it and correct it. Okay. So I'm still working on a little bit more for this jawline region. So I'm using a gauge 23 cannula, and I'm staying in the subdermal plane, and it's a linear retrograde here at this part here. Or I also do combination retrograde and anterograde. Okay, just to improve the sulcus here. And we wanted to widen the chin. Okay, so before I proceed to the opposite side, I'll finish with this angle of the mandible here. So cleanse again. So the first thing I'll do is directly inject into the angle of the mandible using the needle, okay? So for my needle, I need a gauge 27, okay, and onto the angle. So locate that bony region. So Darwin really has this so-called hypoplastic mandible bone. It's really that deep. So deep, Sir Darwin. Okay? There you go. That's why Darwin really needs to improve the jawline, the mandible angle. And again, make sure you avoid the supra, or rather the antegonal notch here. Okay, I'm palpating for it, so it's there. So I'm avoiding it and pushing again my product here. I'll stay within the injection point and onto the bone. Onto the bone. And then after I push some of my product here, okay, there you go. Now I'll combine it with the cannula method. I'll be doing the so-called, like making the letter L of the area. At the back there, please. So I'll go posterior to that. I'll make an entry point here. Sorry, Darwin, you're still okay?
Yes, sir.
So sponge, please. Okay, so perpendicularly and then go subcutaneously. As much as possible, I want to go subdermally. I can see my cannula a bit. So it means to say I'm in the superficial plane. So I wanted to improve this ramus of the mandible. So wanted to volumize, improve, give that prominence of the ramus of the mandible. Okay. So just fill in that section here. Okay, so a little bit there. And then, since I have my other entry point, okay, in this section, on the angle, near the angle, I'll make another entry point just to improve the body of your mandible. Okay, now avoiding again that antegonal notch, I'll make an entry point here. Okay, multiple entry points for Darwin. And then perpendicularly direct your cannula and then again glide it towards the ramus, okay, towards the angle rather. So we're gonna fill this in to improve that mandible angle. Okay, so it's like a fanning technique again here. You're doing a fanning method in a superficial plane. So we're working on the subdermal region here. We're still good. So just cleanse again the area. Okay. So it's expected to have some pinpoint bleed from that puncture region. Okay. So we're almost finishing. I'm using a very robust material. That's why when I push it through the gauge 23, there's really this effort to really push the product into this anatomical plane. So you need more of an effort to deliver your product. So we're almost done. So this is the technique, the method for injecting our product material, chin area, on the right, and jaw angle, jawline on the right side. So let's proceed to the opposite side. So we have done the treatment for Darwin. We'll show the result when CSA Medical Aesthetics returns. And we're back. We'll now show the result to Darwin. Darwin, here's our mirror. Hold on to it. Yes.
Wow!
Right.
Ang ganda, Dok.
It's your dream chin and dream jawline.
Yes, actually, Doc, na-correct talaga yung dito ko, yung concern
yes,
ko.
the
Then
bulge
it's more
under
defined.
the chin. Exactly. More defined, well-contoured, more masculine, right?
Wow.
And we
I
were
love
able
it,
to
Doc.
improve the length of the chin region. Because a while ago, it was like tilted upwards like that. That's why there's so much of a projection, making this deep sulcus worsen. But right now, we were able to kind of like reverse, do it like a downward there, and make that deep sulcus softened. And at the same time, a better like shape on this part of your chin. So it's more of a masculine type of that chin. And we were able to correct also the labiomandibular fold here, improve the pre-jowl sulcus here. You don't have a jowl. It's just that there's a deficiency here. And then a while ago, while I was injecting your angle of the mandible, the bone was so deep, kind of like you have a hypoplasia of the mandible bone. Although Darwin had already injections in the past, okay? So right now, we just did a further improvement, refinement, and really make that jawline come out, the letter L of that angle of the mandible. And I'm looking at Darwin, well-contoured, balanced proportion. The double chin is gone, okay? More masculine look. Hindi na ganun ka baby face.
Yes, not baby anymore.
Not a baby anymore. Okay. So if you're doing like an animation movement around the mouth area, you can do like smiling, and then like a kissing, and then like movement around the lip region. Well, of course, the muscles, we were able to kind of like also fill in some muscle tissues there. The others are concerned that there might be some difficulty in moving the mouth area, but we were able to place those fillers in the right anatomical region in a kind of like distributing them very well in those anatomical tissues. Thank you so much, Darwin.
Thank you so much, Doctora.
What else do you need? No more.
No more.
Okay, upper, middle, lower third proportion. There you go. Thank you, Darwin.
Thank you so much,
yes.
Doctora.
Thank you so much. If you have any questions, you may email us at csaskinclinic@yahoo.com. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. We have our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Darwin, do you have any like social media if they want to ask you about the treatment? Is it painful? Something like
yes,
that?
Doc. So you can follow me or add me to my Facebook account, Darwin Natividad. So you can see or my post for my post statement. So after a day.
Like your journey with CSA.
Yes, my journey with
jawline
CSA.
definition. Thank you.
Thank you so much, Doctor.
Right. Our other videos is they're posted in our YouTube channel, Contessa Salvador. Please click the like and subscribe button. Okay? So thank you. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.